Stop everything you are doing right now because what I am about to tell you could save you over $1,000 every single month. Starting July 1st, 2026, Medicare is now covering Wegovy and Zepbound for weight loss. The price, just $50 a month. These are the same injections that cost over $1,300 without insurance. But here is the part that nobody is talking about. Millions of seniors who think they qualify are being turned away. And the reason why will shock you. My name is Alex. Stay with me for the next 10 minutes because I am going to tell you exactly who qualifies, who does not qualify, and the key things you must discuss with your doctor to get approved. So what exactly is this program? It is called the Medicare GLP-1 Bridge Program. The U.S. government, through CMS, announced this short-term program that covers GLP-1 weight loss drugs including Wegovy and Zepbound for eligible Medicare Part D enrollees for just a $50 copayment. Now let me put that price into perspective for you. Without this program, Wegovy costs $1,350 a month. Zepbound costs $1,086 a month. For seniors on a fixed income, that was completely impossible. At $50, this bridge program eliminates more than 95% of the sticker price. That is not a discount. That is a revolution for millions of seniors struggling with obesity. Now, when does this start? The Medicare GLP-1 Bridge program runs from July 1st, 2026 through December 31st, 2026, 6 months. And after December 2026? A longer, permanent program called Balance is set to take over in January 2027. But here is the warning, and I need you to listen very carefully. Now the most important question, do you qualify? Let me give you the exact checklist. Write these down. Number 1, you must be enrolled in a Medicare Part D plan, either a standalone drug plan or a Medicare Advantage plan with drug coverage. If you have original Medicare only with no Part D, you do not qualify. This is the number 1 reason people get turned away. Number 2, your BMI must be 35 or higher, that is severe obesity, or your BMI must be 27 or higher plus you have at least one qualifying health condition. Number 3, what are those qualifying conditions? If your BMI is between 27 and 35, you must have heart failure with preserved ejection fraction, uncontrolled high blood pressure, or chronic kidney disease to qualify. Number 4, your doctor must submit a prior authorization request and a prescription through the program as official system. This is not automatic. Your doctor must know about this program and submit the paperwork correctly. Number 5, your specific Medicare plan must opt into this program because not every Part D plan is automatically participating. So even if you meet every medical requirement, if your plan hasn't opted in, you cannot access the $50 price through your plan. Does that mean you are stuck? No, and I will tell you exactly what to do in just a moment. Now let's talk about the 5 reasons why millions of seniors are going to get denied and how to avoid every single one of them. Denial reason number 1, your Part D plan did not opt into the program. This is the biggest one. After December 2026, the longer-term balance program is completely voluntary for plans, meaning if your plan does not join, you could lose access entirely. What you do, call your plan today and ask, is your plan participating in the Medicare GLP-1 Bridge starting July 2026? If they say no, we will talk about switching in a moment. Denial reason number 2, no obesity diagnosis on file. Your doctor must have formally documented your BMI and obesity diagnosis in your medical record before submitting the request. If it is not on paper, the system will reject it automatically. What you do, call your doctor's office and say, I need my obesity diagnosis formally documented in my chart before my GLP-1 authorization request. Denial reason number 3, you are on the wrong Medicare plan. This bridge program operates completely outside the normal Part D benefit, which means your deductible does not apply to it and extra help assistance does not cover your $50 copay. This surprises many seniors. Even if you normally pay almost nothing for medications through extra help, you will still owe the $50 per month for this program. Denial reason number 4. Your doctor submitted the wrong paperwork. Doctors must submit prior authorization requests through the program's centralized processor, not through your regular Part D plan. This is a brand new system. Many doctors' offices do not know about this yet. What you do, print out the CMS GLP-1 bridge information from CMS.gov and bring it to your doctor's appointment. Denial reason number 5. You are using the drug for the wrong reason on paper. This is confusing and very important. If your doctor prescribes you Wegovy for cardiovascular risk reduction or diabetes, that prescription goes through your regular Part D plan at regular prices. The $50 bridge price is only for weight loss specifically. These are two completely different systems, even for the same drug. Make sure your prescription clearly says weight management and weight reduction. Okay, I know that was a lot of information, but here is the good news. Every single one of those denial reasons has a solution. Let me give you 3 clear steps. Step 1. Check your plan right now. Call the number on the back of your Medicare card and ask these exact words. Is your plan participating in the Medicare GLP-1 Bridge program starting July 1st, 2026? If yes, fantastic. Move to step 2. If no, go to Medicare.gov, Plan Finder, and filter for plans that cover GLP-1 weight loss drugs. You can switch plans during a special enrollment period if you qualify, or during open enrollment in the fall. Step 2. Visit your doctor before July. Do not wait until July 1st to start this process. Go to your doctor now and say, I want to apply for GLP-1 coverage under the Medicare Bridge program. Please document my BMI and obesity diagnosis in my chart today. That documentation is what opens the door. The Balance program also pairs your medication access with a free lifestyle support program from the manufacturer at no extra cost, so you get the drug and the support program together. Step 3. Know your backup option. Even if you do not qualify for the $50 bridge program, a new direct-to-consumer portal launch in January 2026 could allow anyone to access GLP-1 medications at approximately $350 per month regardless of insurance status. That is still very expensive, but it is far better than $1,300 a month. Now, I have to address a very common question I know many of you have. What about Ozempic? What about Mounjaro? Here is the honest truth. At the time of this video, the Medicare GLP-1 Bridge program covers 2 drugs specifically for weight loss, Wegovy and Zepbound. Ozempic and Mounjaro are not part of this $50 bridge program for weight loss, unless your doctor is prescribing them for type 2 diabetes or heart disease. If you take Ozempic for diabetes, your regular Part D plan covers it. If you want it for weight loss specifically, it must go through the bridge, and currently Wegovy is the semaglutide option covered there, not Ozempic. I know this is confusing. The bottom line, talk to your doctor. Tell them exactly what condition you are treating. They will guide you to the right drug under the right program. Let me give you the simple summary before you go. Starting July 1st, 2026, Medicare is covering Wegovy and Zepbound for weight loss at just $50 a month through the GLP-1 Bridge program. These are drugs that cost over $1,000 without coverage. To qualify, you need Part D, a BMI of 35 or higher or 27 plus, a qualifying condition, a doctor who documents everything correctly, and a plan that is participating. 5 reasons you might get denied: wrong plan, no diagnosis on file, wrong drug use case, wrong paperwork process, and extra help does not cover this copay. 3 steps to take today: call your plan, visit your doctor, and know your backup options. If this video helped you understand this program, please hit like right now. It helps other seniors find this information. Drop your Medicare plan name in the comments below. I read every single comment, and I will tell you personally if your plan is likely participating. Subscribe and hit the bell, because next week I am covering something even bigger about Medicare drug changes in 2026 that every senior needs to know. Stay protected. I will see you in the next video.